Officials from the State House Monitoring Unit camped in BUDUDA district for 2 weeks to monitor the status of health services in the district, visiting Health Center 3's, Bulucheke Health Center 4, and the General Hospital. The State House Health Monitoring Unit is considered the third eye of the President for healthcare delivery, established in 2009 as a presidential instrument with the mission to monitor, strengthen, and hold accountable the national healthcare system to provide equitable, responsive, and affordable healthcare services to the Ugandan population. Dr. Stephen Ataro Ayera, the Assistant Director at the State House Monitoring Unit, said that as it's a mandate for the unit to monitor service delivery, there was also a concern of a high number of referrals to Mbale General Referral Hospital, and so they wanted to establish a pattern starting from the lower facilities to the General Hospital and what the findings were.
It's part of our mandate to monitor service delivery in the country, but there was also concern about high number of referrals to Mbale Regional Referral Hospital. So we came and established this pattern starting from the flow from the lower facilities to the General Hospital and then out of the General Hospital. We've actually found that most of these referrals to Mbale are self-referral, not made by the facilities. Cases of referrals from the facilities end up in BUDUDA General Hospital and they are managed. We came to Bulucheke Health Center 4 specifically because one, it's an upgrade facility but has been functioning as a level 3 in terms of supplies, infrastructure and equipment. So this community dialogue is to help raise awareness with the leaders to support the expansion, like rehabilitation of the theater. The block is just here, is not functioning. And then in the space, as you see, the facility is not fenced. There's a lot of trespass from the community. And also there's encroachment. We've seen a house built in the facility land. And to sensitize the community about the new services which are going to be provided here, e.g. maternity, obstetric emergencies, surgeries being done, and now functioning as a level 4 instead of 3. Generally, the district is performing well compared to what we had had. And the main problem in the General Hospital is staffing. The staffing level is very low. Most departments are understaffed. We don't have any single specialist. Yet by structure, even the old structure needed 5 specialists to be in the General Hospital. There is none. And in the different health facilities, you find the number is less than 30%, 20%. So with that, it becomes an issue. On the side of supply chain, we did not see any evidence of leakage or supplies being stolen. Actually, what they have in the district is adequate. Very few facilities reported stock out, but mostly they are even overstocked, and we've advised them to redistribute the supplies. Of course, the bigger challenges is handling emergencies and referral. The place is hilly, so some facilities like Bufuma Health Center 3, a car cannot reach the facility. You leave it 3 kilometers down. And then going uphill, when it rains, mudslide and all those access, it becomes a challenge. Then ambulances are only 2 in the district. So imagine if one has taken a patient to Kampala or to Mbale, then you are left with only one. And yet many of these facilities are on the hills. So, and this facility specifically, water challenge is also there. The community vandalized the water tanks, the taps, and yet they were installed.
In addition, the RDC of BUDUDA district, Juliet Namara Solomon, said that as a district, it has been having a lot of issues in the health sector, among others, understaffing and poor water supply.
We've been having some issues, but we are happy to note today that the Anti-Corruption State House Monitoring Health Unit has given a report that at least attendance is there. There is no drug theft. We don't have a lot of issues, but we need staffing. We don't have staff, which is a very major important thing in this health unit too, so that we can enforce service delivery. And because of that, I call upon the government and the Ministry of Health to look at us, to give us more staff, so that we can afford to cater for the people of Bulucheke. Then another thing, the Bulucheke people have said they don't have a water supply. So me as the resident district commissioner and the COW and the LC5, we have agreed and we are going to make sure the water office in BUDUDA district is going to ensure that the health unit gets water, and we also make sure the supply is all over in Bulucheke sub-county. So the baraza has gone on well. The people have complained. Some of them said that they get a lot of Panadol, paracetamols, but we have agreed. Even now we have drugs. We even got one person reporting that the drugs will expire. That means themselves, they see the drugs are there. But I think those who report that they take Panadols, they don't know why they give them Panadols. Sometimes they come with pain problems. So whatever the anti-corruption state house health monitoring team has given, the reports have all been captured, and we have agreed, and we are going to correct all that is not right, and we shall work in line with them in collaboration to serve the people of BUDUDA and also for service delivery for the government of Uganda. The baraza, we got a challenge of a mother saying that the police actually sends them to a private clinic to do defilement check. So I also urged and told the mothers in the gathering that they should protect and keep our children. And I cautioned the men, because in Bugisu, in the Elgon region, for those who are watching me, it is the highest registered defilement. We register high defilement cases, and also we register high early pregnancies in BUDUDA, in the Elgon, specifically BUDUDA, but even in the Elgon. So I caution the men. There are a lot of big girls who are in finishing schools. Why don't they get those ones? What takes them to do what? To make defilement cases. We need to change this attitude. It's a mindset change. So I cautioned the men to look for all that. If there is a demon in them, they should remove it. They should not defile. And I also told the mothers to keep our children intact, to make sure they cover them properly. They train them. They teach them to do other chores. They teach them that education is key. They teach them that they should not even accept a man to touch them. They should be friends with their children. It all takes mindset. So I instilled it in the mothers, and I told them we shall come back for more sensitization as the office of the RDC. The people of Buluchek, I told them the monitoring team has come for everything that you feel is the extortions. But we have registered no extortions because the people were many. We had a very big turn-up. And I told them, today is the day. Speak what is there. What do they hurt you? Are the nurses working? Do they give you time? But the population, the community actually registered that they are getting service delivery. But to some extent in other health units, there's some little extortions. And we can't say it's not there. I cannot say that, because I know sometimes in other health units it could be there. But for Bulucheke, they did not register that.
According to Dr. Alex Kakala, the district health officer, among the challenges the health sector is facing include understaffing, limited land, and lack of health facilities in some of the sub-counties.
But we are going to engage the Ministry of Health and the Ministry of Public Service and the Finance to add us wage so that we can be able to recruit. The other issues which came up, which need to be addressed by the which will be addressed by the district, include the issues of limited space in terms of land at the health facilities. Most of our health facilities are seated on very limited land, and we don't have land for expansion. So we shall engage our district leadership, the COW and the LC5, to see if we can be supported on this. There are also issues which came up which can be addressed by the district health office, like the issues of fencing. We are going to put this in our budgets. We had the issues of lack of health facilities in some of the sub-counties. As the BUDUDA district, we have 28 lower administrative units, but we have health facilities in only, we have 28 of this, but we have health facilities in only 10. So we are going to plan for having all the sub-counties having health facilities, but of course we can't do this in a day. We shall be doing this in a phased manner. I can pledge that in the next maybe like 3 years we should have a health facility in Buvita. We maybe also in Bumwarukani. These are some of the very underserved areas in the district. Of course, there are also other issues like where the communities are complaining of not getting drugs when they go to the health facilities. We are going to improve on the supervision of the drugs. But I can also say that sometimes some of these drugs, it may not be that maybe they are in the health facility, but they are not being given to the community. Sometimes it is that the drugs are not available to the health facilities. But of course, in situations where the drugs are not available, we encourage that the health workers should politely and explain to our communities. Our community I think it's not very open, because it is not the first time that we hear the community complaining about extortion or being asked for money when they go for health services. But this is not in all the health facilities. It is just in 1 or 2 health facilities. It's actually 1, I can say. But when we go to investigate these issues, unfortunately, sometimes when we want specific evidence from the people who have complained, they decline to come up. Like now you can see even in this health unit monitoring team, they have been here, they have been to all our health facilities, including the hospital, and including during this community dialogue. Nobody has complained about extortion or being asked for money.
The LC5 chairman of BUDUDA district, Geoffrey Natubu, encouraged the health personnel to do work professionally and maturely to avoid issues that will affect employment.
So I want to use this forum to appeal to the members of staff. So you, Mr. Kao, let's be very keen. Things have changed. The health unit monitoring team is here. We also have an anti-corruption unit here. Tomorrow, if you don't do your work properly, they will go with you. I will not be there. Because that is not me, it is now from this report that you have performed well. Now, if you have performed well, none is going to touch you. You are very safe. But if you go beyond the scope and you do something that is contrary to what is required of you, tomorrow they find you with drugs, they find you misusing, they find you mistreating, they find you extorting money. I want to assure you, ladies and gentlemen, I will not be there to help you, to rescue you from the scandal that you have been involved in as an individual. So let's change our character, let's change our approach and the way of handling issues, and we handle issues maturely and professionally to avoid the queries, to avoid the arrests, to avoid the interdictions, to avoid so many other issues that will affect your employment, to affect your future, affect your family, and at the end of the day you go home as a disgraced person.
Bulucheke Health Center 4 hosted the Baraza, where different guests from the State House Monitoring Unit, the political wing, technical staff, security, and the general public attended. Lydia Akiding, Kiria Onkuni, here in BUDUDA district.